what do we need to do in technology and health-related technology to overcome those challenges. I mentioned today's day is special, event is special. We've got a lot of things lined up, but it is super special for one particular reason. We've got with us Mr. Jeroen Tas, who is the head of innovation and strategy at Philips, and he's at the forefront of a lot of things that Philips is doing in order to counter some of these challenges. So without further ado, I would like to request Mr. Jeroen Tas to take stage and share share his insights. Thank you.
Well, good morning. It's an honor to be here, and it's a real pleasure. I've been here many times in India, and it always gives me a lot of energy and excitement. And I always see a lot of opportunity. And that reminds me of about 20 years back. I was sitting with my friend and colleague Jerry Rao in Mr. Kamat's office at ICICI in Bombay. And at that time, ICICI just privatized. And they were more of a corporate bank than a consumer bank. But consultants told them, you have to go into consumer financial services because there's a tremendous need to provide access to financial services. The opportunity to make payments, to save, to get loans. And the consultants told them, why don't you build some big branches in the big cities and address the upper middle class because they're growing very fast. And then Jerry and I said, well, I think there's a bigger opportunity. And the bigger opportunity is to provide access to financial services to big slice of the population, not just in the big cities. And technology can help there. So we can set up internet banking, we can set up smart call centers, but also we can create a physical presence close to where people are. We can put an ATM and a desk in a factory, in an office building, in a railway station. We can create a mini branch where there's an ATM, there's a person sitting behind the desk, and that doesn't need to be the smartest person in the world, but the system needs to be the smartest system in the world. And then you can create easy access to financial services with humans supporting it. So that was actually the birth of the mini branch, and now I see mini branches everywhere. Now take that model and start thinking about healthcare. So what we've done is we created beautiful, shiny hospitals. These hospitals are big, they're expensive. But what we really need is universal access to care. And now we can start applying these models that we did 20 years ago in financial services, and the results of which you see today in India, and start thinking through these models and applying them to healthcare. So why can we create these mini clinics where you can come in with a small pharmacy, where you have people that have access to the best care in the world through artificial intelligence, where you use digital means to keep track of those patients, to care for them at home. So that's the story we're going to talk about. And we're going to talk about how far we are on this journey and what it would take to deploy this at scale. And it's obviously not just technology. It's the business models, it's the reimbursement models, it's the entrepreneurship that will get us there. So we talked earlier about some of the big trends, and Kala talked about it very articulate. But they're really important for us as well to drive our innovation. And the first one is probably the most important one, because all of us want to understand our own health or the health of our children. You know, my daughter has type 1 diabetes. And if I look at the experience she has to keep her disease under control and to live a normal life, it requires a lot of help. Not just professional help, but also help from her family, like me and my wife. If you then look at the system, it's not at all geared towards that. You know, every specialist she talked to is a fragmented experience. So she tells me that I'm the data integrator, that I'm the care coordinator. And if you think about it, that cannot be. As a consumer of health services, the system should be organized around us. It should be seamless, it should be holistic, and it should be aggregated and coordinated. And obviously, we can have tools like continuous glucose meters or insulin pumps or Fitbits. These should all be additional to understanding our condition. And we should use that collective knowledge to help patients like my daughter live a normal life. And we all have stories like this. One of my best friends is undergoing chemotherapy at the moment. And if he describes to me how his treatment is going and the interaction he has with the system, it makes me really sad, because I know there are way better ways for him to be treated, to be guided, to be helped in his disease. So that's the challenge we set out. And we believe there's a better way to pay for this. There's a better way to track whether we really create the right outcomes for those patients, whether they heal faster and better, whether they get back to work. And we should pay for that, not the individual tests or the individual procedure. And we've seen the big changes. In the US, there's now bundled payment for knee and hip replacement. So you no longer pay per procedure, per test, per consult. And we've seen that the outcomes have dramatically improved. So there are better ways to pay for this. There are better places to provide the care. The hospital is actually the last resort. I believe that 80% of what's being done in a hospital today can be done in lower settings, in small clinics, mini clinics, if you will, like the mini branch, or at home. And I know that there are already many services in India that almost creates an intensive care unit at home with standby nurses connected to a telehealth center where specialists can monitor patients in their beds at home. And patients heal much faster at home. There's way less risk of infection at home. So these are the models that we should be pursuing, and they're very well fit in this environment in India. We should be connecting those patients 24/7. So I visited Fortis and looked at how they remotely monitor ICU, intensive care unit beds in small towns. So there's a small team of specialists that through cameras and streaming data can guide the nurses, 1,000 miles away to provide the best care for those patients, remotely, virtually. So if it works for the sickest patients in the intensive care unit, this model can be easily extended for cardiac care, for diabetes, for dermatology. You can dream up any kind of treatment that can be done remotely in a much better way. Lastly, in order to do this, it shouldn't just be hospitals. It should be networks. Networks of hospitals, diagnostic centers, clinics, primary care physicians, home nursing, and all of this coming together into a coordinated system. And we see this happening. And where it happens, it delivers results. So this is guiding us towards our solutions. Now, at the same time, there's a lot of technology coming at us. And this technology obviously provides tremendous opportunities. And especially in a country like India, that's really at the forefront of digital technology, I think there's tremendous opportunities to redefine how we're going to deliver healthcare. And some of the biggest technologies that we see today will have huge impact. And the biggest of all, has the biggest hype, is artificial intelligence. Why is it so important? Why is it so disruptive? Because it's for the first time in the history of mankind that we have a technology that can deal with very complex data and that actually has cognitive abilities. So the more data you feed it, the better the data you feed it, the smarter it gets. It can create knowledge at scale. So for instance, if you look at our cath labs, so 30–40% of all cath labs in the world, where you do the catheter procedures like inserting a stent or repairing a heart valve or applying a localized medication, are done by Philips. So every day, thousands and thousands of procedures are performed by very skilled doctors. What if we can learn from every procedure? What if we can track every patient before they go into the procedure and get diagnosed? They undergo the procedure, they go home, and we track them at home. What if we can accumulate all that knowledge? What if we can accumulate the data on those outcomes and what drives those outcomes? That's extremely valuable knowledge that we can then put into the hands of anybody performing cath lab procedures. Those cath lab procedures can be aided by robots, where the surgeon is actually no longer just wearing glasses, but is wearing a HoloLens, so that he can just keep looking at the patient all the time. And he can see literally the catheter going through the body of the patient, see the vital signs of the patient around the patient, and can actually pull out the heart and look at it from different perspectives. And you think it sounds like the future? We're doing it today. And within 2–3 years, you will see this becoming medical practice. So it gives you a sense of what we can do with the technology. And I'm not even talking about cancer, where with oncology, we can now create a very precise profile of a cancer. So we can take the images, and in the images we can quantify the cancer, we can locate the cancer, we can assess the morphology of the cancer, the aggression of the cancer. Then we can take the tissue, the relevant tissue of the cancer, use our digital pathology to look for biomarkers, look at the type of cancer. We can then identify which cells drive the cancer, because every cancer is unique, and take the genetic code of that cancer, combine all of that in a profile, and then find the right therapy, which can obviously be surgery, ablation, chemotherapy, radiation, or even immunotherapy, where we reprogram the cells to actually attack the cancer. Now, this is becoming so complex. The patient prep, the procedures, the diagnostics, the selection of therapy, the execution of therapy, that it will be impossible to do this without artificial intelligence. And we're already starting to do that. And then we're working with Dana-Farber, one of the biggest cancer centers in the world. And the CEO of Dana-Farber told me, you know, we're one of the best cancer centers in the world, but 90% of our patients are from the Boston area of, Massachusetts. So how can you help us make all our knowledge available to the rest of the world? So together with them, we took these diagnostic capabilities and then applied their defined pathways and basically codified it such that now any hospital in the world can tap into the knowledge of Dana-Farber, feed into the knowledge of Dana-Farber, and contribute to the collective knowledge about cancer. This was not possible a year back. This was not possible 5 years back. It will be possible in a couple of years to have, at any point, anywhere in the world, access to the best care through technology. This is a different model than we're used to. This is a different way that we're going to access knowledge. This is a different way we're going to reimburse the care for this. So these are tremendous opportunities that we can tap into today. And there's a huge need, but it's unbalanced. You know, if you look at the US, people are actually overtreated. They're doing way more tests than are necessary. There are more doctors than required. There are more ICU beds in the Western world than people need. You look at the other side of the world, there's a huge shortage. So there's a tremendous imbalance, which I think we can now address through technology. You know, the largest number of cardiologists on a population are in Spain. So there's no reason why a cardiologist in Spain cannot support a patient in the Netherlands, the US, or India, or the other way around. So there are now tremendous opportunities to rethink access to care and balancing supply and demand of care. And that's the opportunity we're trying to address. And we have a simple framework for that. We basically believe that healthcare is not a set of discrete events, it's actually a continuum. And it starts with healthy living. And coming back to what I said earlier, we can now better understand what drives our own health. We can better understand how we can influence our own health. So as we have that information and those tools, and we apply it to our friends and families, I think we can live healthier lives, and that's what we set out to do. Prevention is personalized. I may have a higher risk of a cardiac disease than some of you. I have high blood pressure, so do my two brothers. It runs in the family. So I need to manage it in a different way. And that applies to all of us. Diagnosis will become very personal as well. You know, the way we screen, the way we test, should be highly personalized, fit for you. And it should all be leading up to the therapy that fits with you. And there's no disease where that's more articulate than in cancer, because every cancer is personal. But even for heart disease, it may be almost a mechanical problem if your artery gets clogged and you put in a stent. But what drives it may be very personal. It may be your behavior. It may be how you eat, how you exercise, how you sleep. It all influences each other. And now we're seeing these patterns as well through artificial intelligence, because it's the first time that we start seeing patterns in very complex information, again, that no human being could see with the naked eye, but the system can. Therefore, it's so important that the data that we feed it is of very, very high quality. Ultimately, it's all about those outcomes, and Kala talked about it, but it's driving how we should look at everything we do in healthcare. With everything we do, we should ask ourselves the questions. Are we giving our patients a better experience and better outcomes? You know, at the end of the day, will they get better sooner? And can we make it sustainable? The staff that's working with those patients, do they have the right information? Can they make the right decision? Do they have access to that huge body of knowledge that's now available in the cloud? And is it a natural way for them to deal with the patient? Can they always look at the patient instead of sitting on a screen entering data half of the time? And ultimately, do we make the system more efficient? Do we have less variance? Can we use scale to drive this and do it at way lower cost? And obviously, that's a big constraint in the emerging world. We should provide quality healthcare under completely different conditions than in the US or the Netherlands in India. And it all starts with this. And amazingly, every time I meet a CEO of a hospital, I ask them a very simple question. Tell me about the population you're responsible for. And 90% of the people respond with, well, we have cancer patients, we have cardiac patients, we have respiratory disease patients. And no, that's not what I'm asking. Tell me about the breakdown of your population. Who are the segments and what are their needs? How do you deal with elderly people who have 5, 6 chronic diseases that still live at home, that need to be cared for, that are on respiratory help, that have 5, 6 medication that they need to take, and that actually have early onset of mental disorientation? How do you handle these people? How do you deal with people like my daughter that have type 1 diabetes? You may think all diabetics are the same. They're not. So what are their needs? What are these segments? How do you provide the care for them? And this is nothing new, because the retail industry has done this for years. You know, when I was with Citibank 20 years ago, this is what we did. We looked at 50 million customers and we dissected those customers on their needs, on their financial needs, on their behavior, and we used that to really understand their life stages and craft the propositions around it. That's new to healthcare. And amazing as it is, healthcare hasn't admitted that it's actually a consumer industry. It's about providing the service to consumers to live healthier lives and avoid adverse events and make them healthy as long as possible. And that asks for a different approach. And now we can do it. We can analyze population, we can analyze the cost, we can target, we can segment and structure our services around it. We can empower those consumers to keep track of themselves, share that with their doctors in an interpreted way. So data can stream, but data should be interpreted on the way to flag, early warning signs and guide towards the right care path for that patient. Care can be provided virtually. Again, most of the care can be provided virtually. Most of the cost is actually for chronic disease. Even in India, 80% of the cost is associated with chronic disease. Heart disease, diabetes, respiratory disease. Cancer is becoming a chronic disease. So we have to organize around chronic disease. That means we need virtual care. We need to provide the care at a distance. And we have technology that can do that. So if you look at this picture, it's actually an ultrasound on a tablet. Now that ultrasound is getting smarter and smarter and smarter. So we're working on autonomous ultrasound where anybody can just move the probe and it will guide you to make the right image. That image is being interpreted on the fly. So if we take an ultrasound of the heart, it will identify potential heart disease. You press a button, you can start talking to a cardiologist, and you can do the diagnosis there and then and start prescribing medication and probably give that medication on the spot in that mini clinic I talked about earlier. So these are different models of care. We're doing stuff here that's typically done in a hospital today. So these mini clinics or community centers can also become kind of economic, social, and behavioral hubs. So we have to rethink what drives care, what drives health. And it's not just the clinical aspects, it's education, it's guidance, it's support. So if we rethink healthcare, let's also rethink the social and behavioral aspects of this. And these community centers, these mini clinics, are a really good opportunity to deploy that. So I talked about these complex cath lab procedures. One of our fastest growing businesses is putting cath labs in shopping malls. Now, you would think I'm crazy, but this is literally happening. So these are very complex procedures, technology-driven, that used to be done in the most expensive places in a hospital, and now we're doing it close to where people are. And these are networks of small practices where cardiologists said, okay, I'm going to do this where the people are. They can come in, they get a stent, and they walk out the same day. And we keep monitoring them through digital tools. So it's amazing what we can do with technology, and it's happening today. This is not in the hospital. This is in a shopping center. So I told you that we monitor beds, ICU beds remotely. So we have cameras, and these cameras are getting smarter and smarter. Computer vision, I believe, is one of the most important technologies for healthcare. So we already can track vital signs through cameras, respiratory rate, heart rhythm, SpO2. But we can also recognize stress. We can see onset of delirium. We can even see if you might have a lesion on your face. We can very accurately track your emotional state. With a standard camera and an AI chip next to it, we can detect falls. We can see if people fall out of their bed. So there's huge opportunity to monitor, to support, to enhance. And ultimately we see a system where it's all around us, where we carry with us the data that's relevant and we stream it and it gets interpreted on the fly and we get professional support as and when we need it because the system will detect it. and will automatically trigger it. This is not crazy. It happens in other industries. We can apply it to healthcare. But we have to recognize it. It all starts and ends with us. And it should all be centered on us. And what we see is that we can create a system that pursues better outcomes for all at lower cost. And that allows us to live healthier lives and support people anywhere, anytime. And we can do it not just in Mumbai or in Delhi. I think we can do it anywhere. We can do it at scale and at dramatically lower cost than we have done before. I think we're all here on the eve of something big, and a healthy population will be a healthy economy, will be happier people. So I think it's a tremendous opportunity to pick this up and run with it. Thank you.